So I'm Hassan from Our Future Health with Bilal. We're here to represent a charity in partnership with the NHS to make sure that our future health research program is more equitable, trying to promote research into non-communicable diseases such as dementia, cancer, Alzheimer's and so on. And hopefully we can, if you come round to our stall, we'll provide you with further information. Thank you very much.
Good afternoon everyone, and a very warm welcome to you all. My name is Dr. Fahim Shakur, and I'm delighted to welcome you to the Health and Humanity event here at the Catherine Beckett Community Centre. Today is about bringing people together. Hopefully people of all different backgrounds, all ages, and all different walks of life, for a shared purpose, to learn, to connect, and to take positive steps towards better health and also well-being. This event was created with one simple belief in mind: a healthier community is a stronger community. And that strength comes from looking out for one another. You'll find a range of things happening throughout the day. Some of it's still getting organized. You've got lunch at the back from the hatch. Lunch is here, so hot lunch, please do make sure you get some. There's also tea, coffee, drinks all available, food to enjoy, to together explore everything that's going on. There's a range of stalls with mehndi as you come in. On your left, you've got the free health checks happening as well in the meeting room. You've also got stalls offering well-being, health and community support, and you've got a full program of short talks from specialists and experts exactly where I am in this room. So please feel free to come in here as well. There'll be opportunities to meet the local clinicians and healthcare professionals as well. In addition to that, we've got speakers who are consultants, GPs, counsellors, healthcare leaders, all here as volunteers. It's hard to get such a range of highly skilled experts on a Sunday. So please can we have a round of applause for that. Whenever I mention this to people, they say, how do you manage to get them on a Sunday? And it's nothing to do with me. It's to do with their generosity of spirit. So I think I'm really pleased to call a lot of them my colleagues and even some of them my friends. And I really do hope that we can continue doing these sort of events in the future as well. It's important to acknowledge all the support and sponsors. An event of this magnitude cannot happen easily. Preston City Council, I appreciate the councillors who are here, have provided funding and support for today. Puka, the charity, very well-known charity here in Preston, have provided a lot of support. The University of Lancashire as well, Biomedical and Pharmacy Sciences Department, BAPS, they're at the back doing all of the health checks today. They provide a lot of support. The Rotary Group at Preston South, Exton Hall Hospital, Our Future Health, who you heard a few minutes ago, and all the organisations and volunteers who made today work.
So to make a diagnosis, this is the body maps. Every, subhanAllah, Allah creates us in a fantastic way. Every nerve going for a specific area. Neck and chest and also the back, that's why we talk about it. So we know exactly clinically, but when we test as well, we look for the abnormalities. If still the picture is not clear, we may have to do some investigation like X-ray, usually if you suspect fracture, MRI scan if you suspect any nerve problem or a disc problem, CT if you suspect mainly disease, bone disease, and then the bone scan is for metabolic disorders or a tumor. Some other tests is done, but more specific. A very important point when the patient comes to us, not only with the back or back and leg, they've got a lot of comorbidity, which sometimes more important than the condition. We have to consider that, assess it, and help as well. So look at this from a lot of research, what patients with back pain have. More than half of them has difficulty in sleep, lack of energy, drowsiness, difficulty in concentration, depression, anxiety, poor appetite. All that's a problem. And some people say, I've been like this for a long time, but that's not normal. It has to be properly assessed and properly treated.
Women's bodies usually change during the pregnancy, and quite a lot of hormones released from the body, and which is the necessary to women know about it and just go for and ask for the more details, because every bit of pregnancy needs help. And mostly women, I noticed during the research, they're ignoring. They said, that's fine, I'm pregnant, yeah, and just getting care from the midwives. Yes, you are getting care from the midwives, but you need to know about yourself because more education is needed. Also, early pregnancy, checks. You are going every time with the midwives before and after the 10 weeks of pregnancy for blood tests, for sugar tests, for ultrasound, and you're taking the vitamins as well.
Yeah, my name's Adil. I am selling some fresh homemade bakes. So there's mango tiramisu, there's some red velvet cheesecake cookies, a Turkish crying cake, if anyone's heard of it before, and some pistachio tiramisu.
Hi, so my name's Jasmine. I'm local to Preston, and my stall is all about fundraising for various charities. I fundraise for Old Age Hospital, Cancer Research and Palestine, and you have the opportunity to make your own personalised drink.
Hi, yeah, we are an NHS commissioned service for the preschool immunisations uptake across the whole of Lancashire.
Thank you so much. And also, you're from Deafway.
So Deafway are a charity-based organisation who support to strive to help the deaf community have a better quality of life. We provide sign language classes, deaf awareness classes, and also social events as well.
Can I ask Exton Hall if you want to say a few words? One of our sponsors today.
Okay. Hi, I'm Lee Murphy. I'm a consultant podiatric surgeon at Exton Hall. I'm here with Suzanne Arnold, who's their business relations manager. So feel free to come over and find out all there is at Exton Hall Hospital. I'll be offering free foot health checks for approximately 8 minutes if you get in there.
I'm from St Catherine's Hospice in Lostock. We help people in Preston, South Ribble and Chorley, and we're about end-of-life care, but also from when someone has a diagnosis where they're maybe not going to get better, but we can help people live well and quality of life right to the end of life. We're really close with the hospitals, GPs and district nurses. So a lot of people don't know that our nurses actually go to people's homes as well. So you don't have to be a patient in the hospice ward, the inpatient unit. They come to all over their place. They go to people's homes. We have about 300 patients at any time under our community nurse specialists. They're out and about in their cars all day, they're at people's homes. We also look after carers in the family because we know how important they are and they need our support too. And then people tend to come into the hospice. We have 19 beds. Lots of support. They tend to come in for about 2 weeks, get their symptoms managed. So 60% of people who come into the hospice actually go home again. So people are really surprised to hear that. And so some people come in and they go home again because they feel so much better, because our doctors and nurses and health professionals and social workers, they are really experts in managing pain and symptoms. So most people who come into the hospice, they go home again, or they stay at home and get looked after by our nurses. So if you want to have hospice help, then please ask your GP, your district nurse, your health professional, and it's completely free. We are here for everybody without compromise to faith or no faith at all. So please, if you're unsure, contact the hospice or ask your health professional.
because you're doing more than you should. So if it's someone who's done, say, DIY for the first time in 20 years and you've sanded an entire room, well, your hands are going to be sore because you've done too much. Your hands are not conditioned for that sort of thing, and that's the reason why they become painful. The second issue is when, say, for example, if you've changed something, so you're at work, you've bought a new keyboard or a laptop which is stiffer, you're using instruments at work which you haven't used before, you've changed something as simple as your mattress or your washing powder, that can cause pain in your hands. So it could be something as simple as that. The other part of that is that something might have changed. So arthritis doesn't develop overnight. So things, there are certain conditions in the hands that you will not just get all of a sudden, but it will be very much, you've gone from having no pain to a lot of pain all of a sudden. It could well be just an injury that sets that off. It could be that your wear and tear in your joints got to a point now where it's starting to become a problem.
So when we talk about rheumatoid arthritis, we are going back by centuries. So in early 1800, French physician Augustin Landry-Bouvet felt that this type of arthritis wasn't similar to the typical gout. And another 50 years later, it was Sir Garrett who felt that the fluid of these patients don't have crystals, so it must be quite different. And it wasn't until 1890 when his son gave it the formal name rheumatoid arthritis.
Okay, so my role in the work is as a counsellor, psychotherapist, and it's about talking. I'm not pill therapy, I'm talking therapy. Well, that's the plan. And just some pointers really today as to the kind of work I provide. And the first thing is that whether we're doctors, whether we're cameramen, whatever our role is, we are here as human beings. And human beings are somebody that's subject to stress and other issues, worry, loneliness, sadness. They can affect us all, and it doesn't matter on colour, creed, religion or anything. And it's how we deal with that. And mental health is just as important as rheumatoid arthritis, in that often they go hand in hand, don't they? If somebody's suffering from bad arthritis, they can become depressed, and they become isolated, and they become worried about disfigurement. So that's where we all have a role, and it's about breaking the stigma. A lot of people are scared to talk about their mental health because they think it weakens them. And the amazing thing that whether we are a doctor or whether we are psychotherapists or the cameraman, we've all got mental health. Some days maybe we feel a little bit more mental than others, but we've all got mental health.
So basically, most of the cholesterol comes from your diet, but it also comes from the liver, the gut, and the cells can make it because it is an essential component of cells. But it's a balance between the HDL and LDL that is important. Next slide. Arteries run from the heart to all tissues, to the nooks and crannies everywhere. And the heart itself is also supplied by arteries. Next slide. But fat in your arteries isn't just a result of cholesterol. Yes, you may have a high cholesterol, but the damage is being done by smoking, high blood pressure, diabetes, and weight. So it's not just a matter of dealing with the cholesterol and everything will be fine. So you have to control the number of factors.
So today we're going to be talking about stress and your health. Stress is one very interesting thing that many people know about. How many people know about stress? Yes, okay. We're going to do a little bit of a vote. I think one of the habits I have is I like interaction, okay? So, first of all, is stress a good thing? How many people think it's a good thing? Okay, got a few people. Okay, good. How many people think it's a bad thing? Yes, okay. And I think the good answer when it comes to stress is it depends. We all need a level of stress in our lives. And that's the reason why from the moment you were born, as in literally born, you needed to be pushed out one way or the other to come out. And if you did not go through the birth canal with the contractions of your mother, you would come out quite floppy, because as you're going through that stressful birth process, the fluid that has been in your lungs when you were sitting in your mother's womb will not be squeezed out so that you can have lungs that are filled with air. Does that make sense? So even from the time you were born, you need a little bit of stress in your life to get things moving. And that's the reason why our bodies are such phenomenal entities, whereby in the morning, there is a chemical called cortisol that is released to help us to cope with the different stresses of the day. Cortisol usually peaks around 9 a.m. thereabout and it starts going up, and it keeps going till the time when it starts coming down. Cortisol is a chemical or a hormone that we call it, which helps you with regulating certain processes. So when you have cortisol rotating or moving around in your blood, it can cause your heart to go faster. It can cause your blood pressure to rise. It can cause your blood sugar to, if it's sustained, to be impacted in a way that is not particularly great because it's impacting on insulin. It can also cause you to have blood flow to the areas of your body where you need to keep your survival. So if for example, this door were to swing open and in came a lion, what's going to happen? Would you sit down and say, oh, kitty cat, you're amazing. You're going to get up and you're going to run. Nearest exit. I know that's going to be my exit. I will break through glass if I need to. But cortisol, what it does is when you have this high stress, your human first instinct is to survive. Get out of there. Either fly, freeze, or fight. And what are the parts of your body that helps you do that? Your legs, your hands. Not so much your brain. It's when you're thinking and trying to strategize, your brain starts saying, okay, you know what, I would do this instead of that. And so blood does not really flow to your digestive tract as much. And that's the reason why when someone is stressed, they tend to have digestive problems. They tend to have this bloated abdomen. They tend to feel like constipation, diarrhea, and all those other features that we normally call irritable bowel syndrome, IBS type symptoms. Because the priority is not to digest your food, the priority is to stay alive. And so, stress in itself, while it's not a bad thing, when it is sustained, when it's high all the time, it can impact your health adversely.
So I'm Professor Mohammed Munawar. I'm a respiratory consultant at Lancashire Teaching Hospitals, and it's absolutely a pleasure and a privilege to be here in this outstanding event, something completely unique on health and well-being. And I've been asked to speak about a very important topic, that is about stronger lungs, smoking, lung cancer, TB. So, and I've been impressed with the way it's been organized, tremendous amount of interest, and very interactive crowd. So I think we have passed on some take-home messages and learned ourselves as to how to tackle these problems together as a community.
So my name is Dr. Shahjahan Qazi. I'm a consultant at attendees. I work at Lancashire Teaching Hospitals. I'm here at this event to try to present positive messages about diabetes and how we can prevent it and how we can treat it. And this day has been excellent in learning about other chronic health conditions and how we as a community can tackle it.
Hi, I'm Seema from Seema Mind. I'm a life coach. I am talking about how to nurture yourself and your relationships to better your health and well-being. It would be great to have this conversation today because it's a way to build awareness with the community, to have open conversations about things we don't often talk about and find practical ways on how we can help ourselves.
Hi, I'm Irfan. I'm one of the cardiologists here, and it was a great pleasure to join here in the community center with Fahim Shahoor, who organized just a fantastic program. My talk was on Know Your Numbers. It went very well, and thank you very much for inviting me, Fahim, and all the your team. I really appreciate it. Thank you.
Hi, my name is Dr. Waqas Gawa. I'm one of the gastroenterology and hepatology consultants currently working in Morecambe Bay Trust. I have attended today's community event, which was organized by Dr. Fahim Shahoor. It was an excellent event with a wide range of topics and a wide range of attendees. And I participated as a speaker to talk about the IBS, myths about it, and how we can tackle them in the community. It went very well. It was all well attended with a lot of question answers and a lot of discussion which arose from it. That's very common. And a lot of community activities for the kids and for the other healthcare professionals as well. I think Dr. Shahoor has done an excellent job in organizing this, and he should continue organizing these kind of events.
My name's Shawab. I know Dr. Fahim in a professional capacity. I work within the medical industry, but not as a healthcare professional. I work at a pharmaceutical. For me, it was really interesting to come and have one of these clinical education meetings as a member of the public, because it's still quite important for myself to know about these things. I find it really interesting, find it very informative, and I've picked up quite a few things as well which are quite interesting, so in particular with the diabetes side of things, and also from the shisha kind of element as well, because it's something that's part of like the social circle. We do that quite a lot. I do that as well, so that's been quite really interesting to learn about that as well. It's been a nice development. Last year I attended last year's session as well, so it's been nice as a development from that. There's been more lectures on more specific topics, so the topics I attended were diabetes, cardiovascular, and spiritual and the lung elements as well. So I look forward to coming to next year as well.
It was good. I think I not only enjoyed, I think there was an opportunity to learn new things as well. Because I had my own talk in it, so I think I was excited as well. That's good. Yeah.